Welcome to Lesson 9 on Directional Terms, Body Structure Word Building, and Body Organization Abbreviations. We begin on Slide 1 from Page 1 with foundational directional terms. Clinicians use these paired anatomical terms to describe the relative position of body parts in standard anatomical position. Notice the arrows pointing to each directional term as we narrate. Superior, also called cephalic, means more towards the head or upper part of a structure. Conversely, inferior, also called caudal, means more towards the feet or lower part of the body. Anterior, or ventral, refers to a structure located more towards the front or belly side of the body. Its opposite is posterior, or dorsal, which means more towards the back or spinal cord side of the body. Medial describes a position more towards the middle or vertical midline of the body, whereas lateral means more towards the side or away from the midline. Finally, when describing limbs, proximal means nearer to the point of attachment to the body trunk, such as the shoulder or hip, while distal means farther away from the point of attachment to the body trunk, such as the wrist or ankle. Moving to Slide 2 from Page 2 of our lesson, observe the arrows pointing to additional directional terms and standard lying body positions. First, we examine organ landmarks. Apex refers to the tip or summit of an organ, such as the pointed apex of the lung or heart. Conversely, base refers to the bottom or lower part of an organ, serving as its anatomical foundation. Next, we contrast depth relative to the skin. Superficial means located more towards the surface of the body, such as the epidermis of the skin, whereas deep means located further away from the surface of the body, toward the internal structures, such as deep muscles or skeletal bones. Finally, clinicians define two primary horizontal lying positions for physical examinations and surgical procedures. Supine describes lying horizontally on the back facing upward, whereas prone describes lying horizontally on the stomach facing downward toward the examination table. On Slide 3, follow the arrows as we study body structure word building. When adding a suffix beginning with a vowel, the combining vowel O is dropped. Combining the root abdom with suffix al forms abdominal, of the abdomen. Combining the root anter with suffix eor forms anterior, of the front. Combining the root brachy with suffix al forms brachial, of the arm. Combining the root caud with suffix al forms caudal, of the tail. Combining the root cephal with suffix ic forms cephalic, of the head. Combining the root cervic with suffix al forms cervical, of the neck. Combining the root crani with suffix al forms cranial, of the skull. Combining the root crur with suffix al forms crural, of the leg. Combining the root dist with suffix al forms distal, of away. Combining the root dorse with suffix al forms dorsal, of the back. Combining the root epitheli with suffix al forms epithelial, of epithelium. Combining the root glute with suffix al forms gluteal, of buttocks. Combining the root infer with suffix eor forms inferior, meaning below. Combining the root later with suffix al forms lateral, of the side. Combining the root medi with suffix al forms medial, of the middle. Combining the root muscule with suffix R forms muscular, of muscles. Combining the root ner with suffix al forms neural, of nerves. Slide 4 covers the second half of the body structure word building table from page 4 of our lesson. Follow the arrows as we read how each word root combines with an adjectival suffix to form a term meaning pertaining to a body structure. Combining the root organ with suffix I forms organic, of organs. Combining the root pelv with suffix I forms pelvic, of the pelvis. Combining the root peritone with suffix al forms peritoneal, of the peritoneum. Combining the root plur with suffix al forms plural, of the pleura. Combining the root poster with suffix ire forms posterior, of the back. Combining the root proxim with suffix al forms proximal, of near. Combining the root pub with suffix I forms pubic, of the genitals. Combining the root somat with suffix I forms somatic, of the body. Combining the root spin with suffix al forms spinal, of the spine. Combining the root super with suffix ire forms superior, of above. Combining the root system with suffix I forms systemic, of body systems. Combining the root thorac with suffix I forms thoracic, of the chest. Combining the root venter with suffix al forms ventral, of the belly. Combining the root vertebra with suffix al forms vertebral, of vertebrae. Finally, combining the root viscer with suffix al forms visceral, of internal organs. We conclude on slide 5 from page 5 with standard body organization abbreviations used in medical records. Observe the arrows pointing to each abbreviation, its full meaning, and structural roots. AP stands for antero-posterior, combining root anter, meaning front, root poster, meaning back, and suffix IOR. CV stands for cardiovascular, combining root cardi, meaning heart, root vascule, meaning vessel, and suffix AR. ENT stands for ear, nose, and throat. GI stands for gastrointestinal, combining root gaster, meaning stomach, root intestine, meaning intestine, and suffix AL. GYN stands for gynecology, combining root gynec, meaning woman, and suffix ology. The abbreviation LAT denotes lateral, combining root later, meaning side, and suffix AL. LE stands for lower extremity, referring to the leg, while UE stands for upper extremity, referring to the arm. In abdominal assessments, LLQ stands for left lower quadrant, LUQ stands for left upper quadrant, RLQ stands for right lower quadrant, and RUQ stands for right upper quadrant. Finally, MS stands for musculoskeletal, combining root muscule, meaning muscle, root skelet, meaning skeleton, and suffix AL. And OB stands for obstetrics, the specialty of pregnancy.